Hi everyone, and welcome to Stay Strong Online. Today what I'm going to do, it's not an exercise routine so much as I'm going to show you what to do with your pulleys at home. So those are your overhead pulleys. Most of you will get them from your physiotherapist, and these exercises can be done within the first week post-op. I would recommend you check in with your physiotherapist or your physician. The reason I'm providing them here online is that after you go through surgery, you're given a lot of information to take home. There's been a lot going on, and then you come home and you're sort of a little bit confused of what was I supposed to do, how many times. So what I want to do is show you different ways of using your pulleys, showing you the pendular exercise and also the pumping. And these are exercises that are recommended by the Canadian Cancer Society for the first week post-op. So that's post-lumpectomy, mastectomy, biopsy, even breast reconstruction once your drains are removed. So again, clarification, check with your own healthcare provider before starting, but these are guidelines. Now, saying that these exercises can be done the first week post-op, you can continue to do them and you can always come back to do them because there are a lot of nice chest opening and shoulder opening. And again, when we open up our shoulders, when we move our shoulders, we breathe well. So when we breathe well, we feel better, we feel healthy, and when we feel better, we look better. I think so anyways. All right, so we're going to start. Usually what I would recommend, because I don't have a door here, you put these or get somebody to help you to clip them in your door. If you haven't got them from your physiotherapist, you can probably order them online. There's a number of overhead pulleys. These are Canadian made, and I can't remember the actual name of them. But they're not expensive, and they're a great tool to have for you at home. So because I don't have a door here, I'm going to go down on my knees. But you can start sitting in a chair against the door. Just make sure nobody comes through. So if this is my affected side, I'm going to start with a bent arm on my affected side. It's a shorter lever. So I'm just going where I can go to start with. You should feel a bit of a stretch, but not pain. Be your judge on your body. So this doesn't necessarily mean more pain, more gain. We're just gonna go along nice and smooth. So this is an active assisted exercise. Now, as you progress, you can extend that arm. So the first phase is right in front. As you progress it even more, then you bring that arm out to the side. So I'm at about a 45-degree angle. Then you take it out, right out to the side. Don't go here first, okay? Start facing directly with your arm in front. If you are creative, and hopefully I'm coordinated, you can do circular motions going forward. There we go. And you can do them the opposite way. These aren't exciting exercises, so I'm trying to make them as exciting for you as possible. There, so we've done the front movements. Now the other thing you could do is go behind. So I can take this with my thumb first facing down, and I'm just going to, I'll turn my back, so I'm just trying to reach behind my back with the pulley. So the front arm is helping to assist the back arm. Again, another functional movement. Don't be discouraged if you start and you just get it behind the hip. Also pull up the whole time. If I'm slumping, not good. If I pull up, I allow more mobility into that shoulder. So those are the ones that you could do sitting or standing, depending on your height. You can also go and do what I call sort of the cross-country ski motion or walking motion. When we walk, we swing our arms. So you want a little bit more mobility. Again, pulled up, nice and tall. Turning around, you can do this backwards. So, or from facing the other direction. So you get a little bit more of a pull. And one of the stretches that I like with the pulleys is taking those arms where you feel comfortable, leaning forward, and I'm going to put my palms out this way, almost like jazz hands, and I've got a nice stretch. I can also lift it up here again, nice easy stretch for those pec muscles. All right, I feel like this is like a Titanic pose. So remember the Titanic stretch, even just stepping forward and back and forward and back. If you're going to hold the stretch, take about 3 deep breaths and let your muscles just like relax into that stretch. Okay, so that is pulleys for sitting, pulleys for standing, and again, wherever you put this, it could be at the top or it could be horizontal when you're doing this exercise. Then you can go on to doing the pulleys, hooking them up at a table leg or a chair leg. Now I have weights. Hopefully I won't pull this too much. I have a heavy weight here. So if you have a heavy table, it's okay. But if you have a chair and you start doing this, not so much. So you lie down on your back. Get yourself comfortable, knees bent. And I'm going to boogie my way here. Thumbs facing forward, long neckline. And away we go. So it's the same exercise that we did when we were sitting on a chair or sitting on our knees. Again, you can do all different range of movement just to keep the shoulders. And with this, I like a little bit of neck rotation too, because when you're lying down, you could rotate your neck to the opposite side of the arm that's up. So it allows a little bit of neck rotation with shoulder movement. And if you really want to challenge yourself, just gently, we talked about imprinting the spine, lift one knee up and the other knee up, right? And away we go. So we can do, let me think, opposition of the legs. So why not work two things, shoulders, abs, and legs? All right, so going on while I'm lying here, you've also been told to do shoulder shrugs and pumping. When you do pumping, put a couple of pillows underneath the affected side so that your arm is slightly higher than your heart. So I'm just going to do this, and I'm going to pump my hand. You can use one of those soft Nerf type balls, circles, and you can also do just a little bit of gentle flexion extension. Remember, our flexors are always stronger than our extensors, so the tendency is for them to tighten. So you want to start moving gently as soon as you can. You can also lift assistedly the affected arm and do just nice shoulder rolls in one direction, say 5 times, shoulder rolls in the other direction. Now going on to, see, I didn't have enough weight there and I pulled the chair. So going on to the final exercise is the pendular exercise. I like these soft balls. I find they're easy on my hands. If you have any arthritic hands, they're nice to exercise rather than a smaller weight. But we'll start off with, when you're doing the pendular exercise, do it up against a countertop and Don't just flex forward like this and then try to stand up, because inevitably you'll probably have some back issues if you repetitively do that. So take a lunge first and feel like you're really relaxed, and this is a kind of a chill position. And you're just going to do just nice, easy, circular in the clockwise. You can do about 10 in one direction, and then you could go into the other direction. You could go forward and back, and you can go across your body. Thumb facing forward, hand going across the body, almost like a tick-tock of a cuckoo clock. All right, so if you come together, then pull up your abs. Again, you're always using your body. If you want, you can take a light weight, not a heavy weight. Don't do a heavy 10-pound. I would think that this, I don't have my glasses on, but I think it's probably about 2 pounds. And again, just even a little bit of weight and relaxed in the hand position, so I'm not gripping, will allow me to just get a little bit more tractioning on the shoulder and allowing some tractioning on the capsule as well. So if you don't have a ball, you can use a soup can or whatever you have that's easy to fit in the hand and give you some nice gentle tractioning to start moving that shoulder. All right, so I hope I've helped you with what to do: pulleys, pendular, and pumping. If you have any questions, please email them to info@staystrongonline.com. And for now, thank you very much. Take care, and we'll see you next time. Bye for now.